And I'm just excited just to talk about my love for public health nursing and a little bit about nurse-family partnership. I knew once I started my profession in nursing that I'd end up working in public health. My first love has always been pediatric nursing, but public health and nurse-family partnership allows me to combine my passion for working with maternal child health also with working in the community. And it's funny, I think I have ended up working in public health nursing because of it's in my DNA. My mom has been a public health nurse in Jamaica for over 30 years, and when I came to Philadelphia and decided to start my nursing education, I didn't quite know I'd end up here, but I have visions of my mother giving oral polio vaccine on our front porch during a polio outbreak in Jamaica. And I also have visions of going with her to clinics in impoverished areas in Kingston. So somehow it made an imprint on me, and it got stirred somewhere along the line, and here I am working as a public health nurse in Nurse-Family Partnership, which is a wonderful program for first-time low-income moms here. The Nurse-Family Partnership is a wonderful program, evidence-based, based on research done by David Oles for first-time low-income moms. Criteria is they have to be less than 28 weeks, low income. And what we do is we see these families, see these young girls beginning in pregnancy, and we continue seeing them doing home visits, weekly or bi-monthly home visits until their children turn 2. It's a wonderful program where we do education and assessment and referrals and teaching and role modeling and partnership. And we help our clients to learn life skills. We focus on 5 areas, what we call the domain. We focus on personal health, maternal health, environmental, life skills, and support, social support. So we go in and we do our visits last anywhere from an hour to an hour and a half. Nurses are able in pregnancy to do health assessments, talk about breastfeeding. In fact, encourage a lot of our clients who had never ever considered breastfeeding to actually think of it as an option. Talk about discipline, talk about preparing for actually, when the child is here, anticipatory guidance on when to expect the baby to roll and why it's so important to put the baby to sleep on the back, encouraging them to go back to school. We try to keep dads involved. This program is specifically for first-time moms, but let's say first-time families, because one of the goals of the program is to help first-time families succeed. So we try to get the dads as involved as possible as well. We had a client who called me just before the holidays to give me an update, and I'm very proud of Terry. I'm sure she won't mind me sharing her name because I actually did mention her in another interview. But Terry is now a nursing assistant enrolled in an LPN program. Actually, I think she just completed the LPN program and is getting ready to do an LPN to RN program. She got married to the father of her baby. She hasn't had any more children. Her daughter is about to turn 7, I think, 6 or 7, to her 2001. Yeah. She was born in 2001, and she is doing really well in school. She's the smartest girl in her class, and Terry says that every now and again she gets her binder and she takes out little lessons that we did so many years ago, and she's so proud that she completed the program, and she actually decided to become a nurse as a result of being involved with the program and basically saying that she wanted to be a nurse like me when she grew up. But it's a wonderful story because it reflects the impact that we can have on these young women, the lives of these young women really well. And some of the other outcomes with our program is there's less cases of child abuse, domestic violence, when these children are followed up long term. higher rates of breastfeeding, higher immunization rates, lower instances where children have interacting with the juvenile justice system, behavioral problems, delinquency problems, making changes for a lifetime. And the program is specifically for first-time moms, because whatever we do with them with this first pregnancy, they go on to repeat whatever it is that they learned during that time for subsequent pregnancies and subsequent children. It's really important for us in our program to empower clients and help them to realize their potential. So we use motivational interviewing techniques where we're helping our clients to make positive changes in their lives, but we're never ever telling them what to do. We help them to identify their strengths, and from their strengths identify goals that they have for themselves based on their unique and already existing abilities that they have that probably nobody ever focused on with them. Asking, what do you want to do with your life? Where do you see yourself 3 years from now? Who are the most important people in your life? Give yourself a picture of what your life will look like 3 years from now, or how you would want it to look like, and then let's talk about steps that you need to take. And if there's a goal that you want to achieve and you think it's difficult, let's talk about what could we do to make it easier for you, or if you want to do something but you think it's not likely that you will do it, how could we have a conversation to talk about what could make it a little bit more likely to actually implement? Say, stop smoking. If you really do want to stop smoking but you don't think you're quite ready, what could be the next step to take you closer to being ready even though you're not ready? So it's important for us that we remember we're focusing first on the client. It is definitely client and family focused, not what we think is best for the client, but what they want for themselves. Once we zoom in on that, client-centered, putting the client first, helping the client identify what their heart's desire is. Once we find out what's your heart's desire, let's help you to get to that point. That when your baby turns 2 and you graduate from the program, have you met your heart's desire? And speaking of graduation is a wonderful event. When the babies turn 2, here at our program, we actually have a little graduation ceremony where we recognize the moms and their babies. They get a trophy and a certificate of completion, and they get together with other moms whose babies turn 2 during the same time. And it's a celebration. It's a celebration because they get to see how many other people went through this with them. They get really proud. They're able to show off their nurse and saying, this is my nurse who came to see me. I really cared about me, and the thing with Nurse Family Partnership is, visits are done in the client's home, and if the clients move, we move with them. So we go to see them wherever they're staying. So it's really a long-term program, so we can really see changes. Very rewarding. Other nurses in the program will always say one of the reasons that they do this is because they definitely can feel that they're making a difference. When you see where your client was when you enroll them during pregnancy, and fast forward to when their babies are 2, and see the changes, see that they completed high school or they got a GED and they're now working, and that their 2-year-olds are so much smarter than other 2-year-olds. They're always comparing, and their language skills are so much better because we push reading. Reading is so important. So we're always telling the parents about reading to their babies, and we give them books to read, and music, the importance of music, the importance of playing with your child, talking to your child, being consistent, having schedules, setting limits, and recognizing that discipline is teaching, and explaining the difference between discipline and punishment. But back to what nursing was really about. It's about being an advocate and an educator, and then seeing actually the results of what you've done with the client 2 years later. So I'm very proud to work with Nurse Family Partnership, and think it's an excellent program. And President Obama has this in his plan. I mean, it is his vision that every city has a Nurse Family Partnership program. So we're going places, and I'm glad to be on board.
Africans are